Hello, my name is Dr. Hunter Mullen, Associate Professor here at Northeast College of Health Sciences. One of the courses that I teach is Cox Flexion Distraction Decompression. This is a technique that is used to treat a variety of different types of spinal disorders, especially patients with disc problems and joint issues. The technique utilizes a specialized table that allows the doctor to apply different forces in different directions to the spine. So here we have a model patient on the table, and I'm going to demonstrate the application of what is called Protocol 1, which would be utilized to treat a patient with an acute sciatic radiculopathy that is being caused by a lower lumbar disc issue. So our patient is already in the prone position where we start them out. And the first thing we'll do is make sure that the patient will tolerate the procedure. And of course, this is called the tolerance testing procedure. So we will find the level of the disc that we diagnosed as the problem and make a contact lifting that spinous process in a headward direction. We apply a certain amount of body weight to the vertebral level that we're contacting, and then match that force by applying a downward pressure on the other end of the table. That's held for about 4 seconds, and then we ease off. We will move our contact a little bit over to the uninvolved side. So today we're simulating a lesion on the right side. This would be a right-sided problem. And we'll contact the uninvolved extremity and do the same thing. We'll apply a cephalward force, that's headward, and then match the force through the lower leg near the ankle, looking for any exacerbation or increase in the patient's complaints. If there are none, we'll move over to the right side, so the contact moves over to the right side. And then similarly, we'll lean into that contact to apply decompressive force in a headward direction, and then match the force through the leg. When this is tolerated, we will ease off, then we will lock the table, and then apply the cuffs after permission is granted from the patient, which we already have. So these cuffs are applied in a very snug manner. And once applied, we traction the foot piece out to take out any slack in the ankles, knees, and hips and other tissue. The procedure is done again. We tolerance test with the cuffs on, especially when the patient is acute or has severe symptoms. And we make sure that there's no increase in the patient's symptoms going into the extremity. And then we test the legs individually as before, looking for any increase in symptoms along the way. And when this is tolerated completely, we can actually begin the protocol. So the protocol involves finding a taut point using digital finger contact to feel when there's some separation of the spinous processes of the segments that we're treating. Once that's felt, we remember where it is, and then we apply a treatment contact, which is basically the softest part of our hand. And we lean in, we lift that segment upward, and then we match the force through the other hand in a rhythmic manner 5 times. Nice and slow and smooth and rhythmic in the application. And there's 5 repetitions right there. After the 5 repetitions, we would ease off, and with a minimum of a 10-second rest, we would repeat that 2 more times for a total of 3 sets. And that would complete Protocol 1. Again, that's for a patient with an acute or severe discogenic radiculopathy, which is the nerve roots in the lower back causing pain into the extremity. Similarly, we can treat a patient with a problem with a disc in the cervical spine or the neck by applying this technique in the cervical region. So the way this is done in the cervical region, let's say this would be for a patient with a discogenic radiculopathy into either the right or left upper extremity, we would find the level that we've identified as the culprit. Let's say it's C5. And we would make our contact from below and come up onto C5 in a very firm manner. This table has long y-axis ability, so it can move in this direction. And then we would apply a little bit of that long y-axis force and make sure that this is tolerated. There's no increase of the patient's complaints. And from there, we would complete 5 slow, smooth, rhythmic repetitions from that taut point. So there's 1 and 2 and 3 and 4 and 5. And that's the basic application of the lumbar protocol and the cervical protocol for a lumbar or cervical disc lesion causing radiculopathy.